Friends, today we are going to discuss about the physiological anatomy of urinary bladder. Okay, here we are going to discuss about the structure, function, and control mechanisms. Understand? And it is hollow muscular organ. And urinary bladder is located in the pelvic cavity, stores around 400 to 600 ml of urine. Okay, main functions are storage and controlled expulsion of urine. Okay, right. And coming to the gross anatomy, the shape is oval when full and pyramidal when empty. Okay, it is oval when filled with urine and it is pyramidal when empty. Okay, the surfaces, the superior covered by peritoneum and infralateral surfaces rest on the pelvic diaphragm. Okay, posterior it is also called base of the bladder. Okay, faces rectum or vagina. Understand? This is a gross anatomy. Coming to the parts of the urinary bladder, the apex, this is the apex of the urinary bladder is connected to the umbilicus. The body, this is called the body and it is the main portion of the bladder. And the third part is fundus. It's also called the posterior wall. This is the posterior wall of the urinary bladder. Here you are seeing the cross section of the bladder. Understand? The neck. The neck, which is funnel shaped extension of the body, passing inferiorly and anteriorly into the urogenital triangle connecting with the urethra. See, this is the neck of the urinary bladder. It passes inferiorly, okay, into the urogenital triangle and connects with the urethra. Okay, the lower part of the bladder neck is also called posterior urethra because of its relationship to the urethra. Okay, here you can see this is the neck of the urinary bladder. Okay, understand? Okay, this pass down and finally connects with the urethra. Understand? Right. These are the main parts of the urinary bladder. First is apex, then body, coming to the fundus, neck. Okay, these are the main parts of the urinary bladder. Okay. Now, internal features. Here you can discuss about the mucosa. The mucosa of urinary bladder is a transitional epithelium. What is it? Transitional epithelium. It's an important bit. And the mucosa of urinary bladder is also thrown into multiple folds, except in the trigone region. See, this is a trigone region. Except here, the internal wall of the urinary bladder is seen as a multiple folds. These folds are called rugae. What is it? Rugae. Understand? Right. And another important part in the internal feature is trigone. Okay, what is this trigone? It's a smooth triangular area. See, this is a smooth where folds are not present, so it is called a smooth triangular area on the posterior wall. See, this is the posterior wall. It's present on the posterior wall of the bladder, lying immediately above the bladder neck. So this is the bladder neck. Okay, this is the bladder neck. It is lies above the immediately above the bladder neck. It is trigone. Okay, the small triangular area called the trigone. At the lowermost apex of the trigone, the bladder neck opens into the posterior urethra and the two ureters enter the bladder at the uppermost angle of the trigone. See, this where this trigone finally end is here into the posterior part of the urethra. What is it? This is the urethra. Okay, this into the posterior part, this trigone will end, and on the either sides of this trigone, lateral side opens ureters. What are these? Right and left ureters. Okay, this right and left ureters open. Okay, on lateral side of this trigone. Okay, finally this trigone opens into the posterior side of the urethra. The trigone can be identified by the fact that its mucosa, the inner lining of the bladder, is smooth in contrast to the remaining bladder of mucosa, which is folded to form rugae. As I mentioned earlier, trigone is identified by the smooth surface, okay, whereas other part of the bladder internally is folded, okay, representing rugae. Understand? Right. These are the main important features of the urinary bladder. If they ask you, you have to mention the mucosa as transitional epithelium and the special feature rugae and trigone. Okay, right. And the musculature of the urinary bladder is detrusor muscle. Okay, three smooth muscle layers are present, like inner longitudinal, middle circular, outer longitudinal. Three layers. One is inner longitudinal, middle circular, and outer is longitudinal. These muscles contracts during maturation. So with the help of these muscles only, the urinary bladder will contract and helps in voiding of urine. The smooth muscle of the bladder is called the detrusor muscle. Its muscle fibers extend in all directions and when contracted can increase the pressure in bladder to 40 to 60 mm of Hg. So, in clinically they used to measure the bladder of the pressure of the bladder to know whether the pressure is normal or high, because in some people who cannot hold the urine, they measure the internal pressure of the bladder to see whether it is due to contraction, increased contraction, or any muscle abnormality. So here the pressure ranges between 40 to 60 mm of Hg. Understand? Thus, contraction of detrusor muscle is a major step in emptying the bladder. Okay, smooth muscle cells of the detrusor muscle fuse with one another so that low resistance electrical pathways exit from one muscle cell to other. Okay, so what it's going to explain is smooth muscle cells of detrusor muscle fuse with one another. See, all the muscle cells fuse with one another. So any action potential developed in one area will rapidly spread to entire muscle and contraction will occur. Okay, that's what this fusion of the muscle cells. Therefore, an action potential can spread throughout the detrusor muscle from one muscle cell to next to cause the contraction of the entire bladder at once. Okay, this is very important. So the muscle name is detrusor muscle, and inner longitudinal, middle it is circular, outer longitudinal. It contracts during maturation, and the pressure is 40 to 60 mm of Hg. Understand? Okay. So the contraction of detrusor muscle is major step in emptying the bladder. Understand? Right. Now we'll talk about the sphincters. These are very important for holding of the urine. Okay, and also for avoiding of the urine. There are mainly two sphincters, internal urethral sphincter and external urethral sphincter. So where is this internal urethral sphincter is present? Each ureter, as it enters the bladder, courses obliquely through the detrusor muscle and then passes around another 1 to 2 centimeters beneath the bladder mucosa before emptying into the bladder. The bladder neck posterior urethra is 2 to 3 centimeters long and its wall is composed of detrusor muscle interlaced with large amount of elastic tissue. Here this internal urethral sphincter is present. See, the muscle in this area is called internal sphincter. Its natural tone normally keeps the bladder neck and posterior urethra empty of urine and therefore prevents emptying of bladder unless the pressure in the main part of the bladder rises above the critical threshold. Okay. What is this main function of the internal urethral sphincter is okay. What is the main function? It prevents emptying of bladder until the pressure in the main part of the bladder rises above the critical threshold. Okay, we have mentioned until the pressure reaches above 60 to 40 to 60, then only this internal sphincter will open and it helps in avoiding of the urine. Understand? Then where is the external urethral sphincter? Beyond the posterior urethra, the urethra passes through the urogenital diaphragm which contains a layer of muscle called external sphincter of bladder. Beyond the posterior urethra, okay, beyond, see, it crosses the posterior urethra, the urethra passes through the urogenital diaphragm. Okay, see, from the neck of the urinary bladder where trigone end there we get this internal urethral sphincter. Again the urethra continues downwards, okay, piercing the urogenital diaphragm. Okay, when it piercing the urogenital diaphragm which contains a layer of muscle called external sphincter of the muscle. Okay, it is called as external sphincter of muscle. This muscle is voluntary skeletal muscle in contrast to the muscle of the bladder. See, this internal urethral sphincter is not in our control. Whenever the internal pressure of the bladder reaches 60, automatically this internal urethral sphincter will open. Okay, but until we want to go to the bathroom, till then we can hold the urine. How? Because this external urethral sphincter is under our control, so this will not allow the urine to come out, okay, until unless we want to pass the urine. So it is totally under our control, understand. So this muscle is a voluntary skeletal muscle in contrast to muscle of the bladder body and bladder neck, which is entirely smooth muscle. The muscles of bladder and the bladder body and the bladder neck is entirely smooth muscle. The external sphincter muscle is under voluntary control of the nervous system and can be used consciously to prevent urination even when involuntary controls are attempted to empty the bladder. So this is very important. Why? This external urethral sphincter is mainly under our control. Understand? Until unless we want to pass the urine, the urine will not come out. Even the internal urethral sphincter opens. Okay. So this is the difference between the internal urethral sphincter and the external urethral sphincter. Okay. So coming to the nerve supply, it is mainly of parasympathetic from sacral plexus S2 to S4. Okay, it contracts reducer and relaxes the sphincter. Understand? The motor nerves transmitted in the pelvic nerves are parasympathetic. These fibers terminate on ganglion cells located in the wall of the bladder. Short postganglionic nerves then innervate the reducer muscle. In the sympathetic, it relaxes reducer and contracts the sphincter. What does this sympathetic? It is opposite to the parasympathetic. So it relaxes the reducer and contracts the sphincter. Sympathetic chain through the hypogastric nerves connecting mainly with the L2 segment of the spinal cord. Okay, this is from thoracic to lumbar, and parasympathetic is from sacral plexus S2 to S4. This one you have to remember. Understand? Sympathetic will contract the sphincter and it relaxes the detrusor. Understand? Whereas parasympathetic will relaxes the sphincter and contracts the detrusor. So emptying will occur. The sympathetic fibers stimulate mainly the blood vessels and have little to do with the bladder contraction. Some sensory nerve fibers are also pass via sympathetic nerves and may be important in the sensation of the fullness and in some cases in pain. Okay, so sympathetic fibers also contain some sensory nerves, so we feel fullness of the bladder and in some cases pain also. Okay, right. And another important nerve supply is somatic nerve, that is also called pudendal nerve. These fibers are somatic nerve fibers that innervate and control the voluntary skeletal muscle of the sphincter. So for any person, if any road traffic accident, anything, if the pudendal nerve is injured, so the bladder control will be lost because it controls the voluntary skeletal muscle of the sphincter. Understand? Okay, that is external sphincter of the urethra is controlled by the pudendal nerve. Okay. So any injury to the pudendal nerve, what will happen? There will be no control of the voiding of the urine. Okay, so this is very important. So coming to the blood and lymph supply, arterial, superior and inferior vesical arteries and venous, vesical venous plexus to the internal iliac vein. Lymph, external, internal, sacral iliac nodes, both external, internal, sacral iliac nodes. Histology, mucosa is transitional epithelium, already told, and muscular is smooth muscle layers, detrusor, outer layer serosa covered by peritoneum or adventitia. Summary: bladder anatomy supports storage and voluntary urination, controlled by autonomic and somatic nervous system, plays critical role in urinary continence. Okay, thank you for your patient listening.